So with the recent rise of COVID-19 in the community, can you kind of tell me what parents should do with the school coming back up?
Sure. First thing I'd like parents to know is that there is a third updated version of COVID that is strictly focused on the Omicron dominant variant, which is in the pipeline. So that should be in doctors' offices soon, within a couple weeks, I would think. Second is that there has been an uptick in the number of infections, and it's something that bears watching, because as COVID has taught us, we don't know a whole lot about it just yet. We're always learning about it, so we need to keep a close eye on this. Right now, it's not alarming, but things could change.
Yeah, and can you kind of tell me what you're seeing in your office, if you're seeing any spikes or anything like that?
No, we have not, but it doesn't mean it's not out there in the community. And we have not seen serious infections, and that's the important part. I think we can expect that we'll continue to see COVID infections, but as long as they remain infections and not serious infections to the point where we're hospitalizing children and having significant illnesses, then we can live with and have lived with minor infections.
And then when should parents make their kids stay at home? You know, especially within these first few months, the kids may be sicker, or
Yeah.
what is that kind
You know, this really goes back to just common sense, and it's not COVID specific. Whenever a child is sick, particularly if they have a fever, they need to stay home. That's irrespective of whether they have COVID, RSV, influenza, or any other common viral illness. If your child is sick, they need to stay home, and they need to stay home if there's a fever for at least 24 hours once their fever breaks. And if they have other symptoms like obviously vomiting, diarrhea, they don't belong in school. It's good for them to stay home and rest and heal, and it's also good for the classroom and the community so that they're not spreading whatever it is that they have. A sick child should stay home until they're well, regardless of what the illness is.
Great. Anything else you'd like to say about this recent resurgence?
I think it bears watching. Right now, again, it's not alarming, but as we've learned, it can also be unpredictable. So we have to keep our eyes open. There is an updated version of the vaccine coming along, so that will be an option. And it remains to be seen whether or not it's going to be an option that is recommended for everyone or an option that is recommended for at-risk individuals.
Great. Anything else to add?
Well, I would add, not COVID specific, but I would encourage everybody to get their flu vaccines, because we can prevent flu, not 100%, but we can prevent it and minimize the damage and illness that causes. And I would also have parents be alert to the option of an RSV IgG monoclonal one-time shot that is going to be available for babies under 8 months of age. This is not a vaccine per se, but it is a antibody that will prevent babies from getting very sick from RSV. And RSV is a lot more worrisome than any of the other viruses that children are exposed to.
Great. And just to kind of tell me about RSV, tell me about how they can get it and kind of the scary thing about RSV.
So RSV is a seasonal virus, although sometimes the seasons are not as clearly defined as we would like, but basically it's October, November to March, April. It represents the leading cause of hospitalizations for newborns with lower respiratory tract infection. And almost all infants will have an RSV infection either in their first year of life or their second year of life. Now, fortunately, many of them will get by just fine, but some of them will get sick and some of them will get admitted to the hospital and some of them will actually require ventilation. So RSV is the leading cause of hospitalization for respiratory infections in infants and children, and we now have the ability to prevent the most serious respiratory infections from RSV by giving those babies an RSV monoclonal antibody. Yeah, it's great. It's a game changer.
It is.
Fantastic.
Yeah, great. Anything else?
I think that's enough.
Perfect.
All right.
Thank you so much.
You're welcome.